Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you a little bit this morning about mouth breathing, and it causes more trouble than you would ever think in there. And I'm an example of this problem. I'm a mouth breather, and I've been a mouth breather ever since I was a kid, and it has a problem with a lot of things about you're developing the mouth and all this. Let's cover some of them this morning. Let me show you. This is a young lady here that we have that has a mouth breathing problem, and when you breathe through your mouth, there's no way you can get air in without having your tongue in the bottom arch. I guess you might force yourself to not do that, but that's the way it is. And your tongue widens the lower arch out, and the lower arch then comes out where cusp to cusp are fitting, and a lot of people will shift their jaw to one way or the other and have a crossbite on one side, and that changes the condyle fossil relationship up here, and it also reduces the amount of airway that you have. When your tongue gets wider and it's not going up in the top of the mouth and spreading out the palate. And let me show you how that affects your mouth. We'll also look here at the young lady. As she gets a little bit older down the line, she's swallowing wrong, and she pushes the teeth out. And the tongue moving up here pushes these teeth out, but it's not when she breathes, it's down here, and it's widening the mouth out and causing this crossbite. The upper molar should fit over this and come in like that, and be the upper cusp would be down on this part, and that keeps your jaw from getting between your teeth. And I have this problem. I bite my cheeks all the time or frequently. And a lot of times when I'm eating, I put some food up in this part of the mouth to keep the tissue out away from the teeth, so I won't be biting my cheeks or chewing on that. It really hurts after a while. Now this makes the palate doesn't get spread out like it should out here, and that reduces again the airway, and also that makes breathing through the mouth more of a necessity and than it would be if you'd left it alone. So the palate will be like that, then it'll go out this way if you correct that thing. Now we stopped this young lady from breathing this way, or taught her, and we opened the palate out up here and spread it out with just a simple appliance. I could have put a palatal separator. That would be probably the better way to do it, but I tried just putting just a simple appliance in. Now this palate ought to be out in this shape like that, and the tongue would bring it out, and this is your airway up here above your opening vault in is your airway. And if you develop it properly, it's out like that. If it doesn't, it's something like this, and it doesn't carry the air as easy. So if you're allergic, it'll shut down the airway much quicker than it will if it's out large and in a better shape. So let's go with this. Now look, this is the simple appliance I put in there. I just banded the second molar back here. And this you can do this in the mixed dentition. Say that's a second molar, that's a 6-year molar, and these are baby teeth in here, baby cuspids in here. And we'll do this early, try to get back in here and break this habit. So we expand this. You can bend this here and push these out, and you can spread this out with just a simple wire in there. Or you could have put something on the outside, but putting it inside and spreading this out and teaching her how to breathe properly and swallow properly, and we were able to do that. Now we did that, and now you see the teeth the upper cusp are coming down on this side. Let me go back and show you where they were. Let's see, let's go back here. Now you see the cusp. Let me erase this. You see the cusp are coming inside the lower teeth, and it was that way on the other side also. And so we widened that out. We just put a little spring in there and taught her out and to keep the tongue off of there, and the teeth came on down in place. It was a simple treatment for a complicated case if it is left alone. And we did this in the mixed dentition. These are baby teeth in here. These are permanent teeth. It's permanent 6-year molars. And that's what we put this thing on. And now you can see this is a 6-year molars. We're just going to come in here with a wire and bring it back up, come over here and come in, and we can push out on these teeth out here with this type of wire, and you push it in and cement it, and you got force on it. If you need to enlarge it, you can press these loops back here, spread it out, or you can just take it out of there and break the cement off and spread it, and then re-cement and push it back in and push it even further. So we widen the mouth out like that. And let's see what, there's the simple appliance that we would use on that. And now the teeth are out on the correct side. You see this is getting less, and she stops her swallowing improperly and starts breathing correctly, and this changes the whole situation. Now you see these teeth are over on the correct side. They're on the correct side on the other side of the mouth also. And you look at the palate. Now look at this palate. It's like that. And if I drop back here and show you the palate when we started, and it is much smaller. You can see where it is here. Now watch it come out. And that's where it was. Now this is the airway up above, and it is far larger. And it also, if you go up, you drop down as it spreads out like that. And you see this dropping of this part right here also increases the airway. And so that helps all the way around. And this young lady stopped this, and it corrected the whole thing. Now, maybe you'll get some benefit out of watching that. I hope you do. And if you do, I hope you'll join our organization and subscribe to our channel. Thank you very much for watching, and I'm going to close out now. Thank you.